Well, I've been using quantitative volumetric MRI for about 12 years now, and I find that it really adds value. It adds a lot of diagnostic value. So this is an AI tool that identifies structures, substructures of the brain, and color codes them, labels them, calculates the volume of those structures, and then compares that to a large normative database. And then you can use this for longitudinal tracking over time. So we use it for the clinical indications of dementia or epilepsy, multiple sclerosis, traumatic brain injury, and pediatric brain development. And we've had great success with it. Our referrers love it. They tend to, once they use it, they don't want to go back to not using it. The reports are generated, and it really does add a lot of value. And I think one of the greatest strengths of quantitative volumetric MRI is it eliminates that subjectivity, because estimates of volume are always made in our reports. As neuroradiologists, when we see atrophy, we'll always say in our reports whether we think it's mild, moderate, or severe. But the problem is that people have different sensitivities for what they think is, so what I may call moderate cerebral atrophy with a temporal parietal predilection, my colleague might call mild atrophy commensurate with age. And then the referrer gets these reports and they're like, okay, well, which is it? Should I be thinking about Alzheimer's, or is this just totally normal aging process? And so this kind of software is very, very useful because it actually quantifies that, so it looks at certain substructures that are relevant to different clinical conditions. So it will calculate the hippocampal volumes and tell you whether that degree of atrophy is commensurate with age or if it's statistically significant for age. And so it's very helpful. It also helps us identify different types of lobar predilections for atrophy, so we can help differentiate between Alzheimer's versus frontotemporal or dementia with Lewy bodies. And so I find that aspect is very useful. There's several different players in this field, but the two biggest ones that we work with is Icometrics. They have a product called IcoBrain, and Cortex. They have NeuroQuant and LesionQuant. We also, again, find it very useful for our multiple sclerosis patients because it calculates the volume of the plaques. And, it's fine. We can count our plaques easily if someone comes in and they only have 7 plaques. But if they have a moderately severe plaque burden and we're up in the 100 plaque range, it's very hard as they come back each year to tell where the volume has slightly increased or not. Or, and also there's differences in, slice sampling and head angulation that makes it really difficult to tell. But this software eliminates all of that, gives us a direct volume measurement, and then will tell us which plaques are increasing in size, which are new, which are shrinking, and it will color code those so that our eye is drawn right to that. It also the LesionQuant product will count the plaques for us. The IcoBrain product focuses more just on volume because they're and I can see both aspects of both sides of that. It's nice to count, but sometimes as plaques enlarge, they can become more confluent, and then it's harder because that may show as 1 plaque versus 2. But really, both of them give the volume, which is the important thing. So we've got the volume for both, and so it's very, very useful software. The other thing is it gives you a great referral advantage. If you're the only ones in your area offering this software, again, I find that people will continue using it once they've tried it, and you end up getting a loyal referrer. And another question I'm asked often is, do we lose money doing these exams? And we've looked very carefully at RadNet, and we found that we actually don't. In fact, turns out non-capitated insurances are very good at covering quantitative volumetric MRI. So they're easy to add on. It's just 2 sequences, and these 2 sequences are really part of most of our routine protocols, And so we found it very, very helpful technology. I think there has been a significant trend towards using this technology more. I mean, again, I've been using it for 12 years and it's always had value, but I've noticed that in the last 5 years, there's been a lot more awareness with AI. We can't go anywhere without hearing about AI and these other tools. And so I really think that technology like this is something that will continue to grow through awareness. I mean, really probably the reason why it's not standard on all of our exams is just due to lack of awareness. Because again, I haven't had any referrers who've tried it and then have wanted to stop trying it. They'll keep referring it for that same clinical indication. So yes, it's going to keep growing. So the one thing that I would love to see is end user interactive capabilities, because volumetric software is only as good as the segmentation. And in my experience with both of the companies we work with, they're very good at segmenting, but it's not a perfect science. So like, for example, in MS, most all the plaques will be counted, and that volume will be, and it will tend to be the same from the prior study. It's the amount of false positives and false negatives would theoretically be about the same and very small. But as an end user, if I do see a plaque that's missed in the posterior fossa, so we use FLAIR sequences, and sometimes plaques are more conspicuous on T2-weighted sequences. So if I happen to see 2 missed plaques in the posterior fossa, I like to be able to drop an ROI on that and have the software recalculate the volume for me now with perfect segmentation. So that's one thing that I would like to see happen.
AI tools have the ability to both reduce the noise and increase the signal of medical images. This allows us to do significant acceleration. They also have the ability to do enhancement of resolution of these tools. And these are starting to become, of these images, and these are starting to become available now in day-to-day practice. There are FDA-approved applications from independent vendors as well as the OEMs that can actually create a much better patient experience and a much more economically feasible and shorter MR examination. So I encourage you to look at those as well over your travails and perusing of the AI market.